All right, Rain. Right away, we got a P right here. What do you see?
Right away, I see a rotation.
Yep.
I see an anterior pelvic tilt.
Yep.
I see a lot of work in that lumbar.
Look at the hands. They're almost on her thighs because they're so rotated forward.
Yup. But that shoulder is rolling forward. Wide stance to help her stand up, like the Eiffel Tower.
Yeah.
Yeah. There we go. Look at that.
Yeah.
So what are we looking at there? Her center line. We would love her feet to be closer to that line. We'd like her legs to be straight, but we really want that butt to drop down or that pelvis to go posterior a bit and then float back over her legs. That would help her out a ton to decompress that low back.
And you
But
can you can see the shoulder rotation from the back. I mean, you can't even see her hands.
you can see her hands. You can
Look at that.
see her watch.
Yeah.
So we know she's there.
It's there.
Yeah, the hands are gone. You can also see for this individual, the hamstrings are weak, right? There's not a lot of tone right under the gluteal fold, but the glutes are strong. This tells us this pelvis is unstable. If she was externally rotated, she could still be unstable, but she'd be really tight.
Now we
Yeah.
have a little bit of fat here. Why is it bigger on the right side than the left?
Because it's not fat, it's actually a dysfunction of her erectors, her quadratus lumborum, and her obliques.
Mm.
So literally think of like if you threw out your beach towel and then it crinkled in one spot and the towel gets rumply. That's what she's done. Her back is so tight, she's rumpled her skin because it's not really fat. It could be fat, but it has a little bit of tone to it. And that's where I say, look at the spine, right in the center. It's really working hard.
Well,
yeah. Right there is a lot. There's a lot going on right there.
There could be some lymphatic fluid in there too, right?
Sure, absolutely. There could be lymphatic fluid all over her. I mean, for sure. Excuse me.
Okay.
The legs and the pelvis. Let's go there. There's our plumb line. So the plumb line is there. So let's look at everything that is on the plumb line. The ankle bone is on the plumb line. Well, that's because you put it there. The next one should be the knee, right behind the kneecap, but in front of the bones. It's almost like a slice. And she's not got that, right? You can see she's way behind the line. Then you go to her pelvis, and right again, where I was talking about those cute little butt cheeks, if you ever seen on the kids, that's your gluteus medius or your lateral stabilizers. If you don't know, stand on one leg, you're going to feel it. Those are not working very well for her. So her bum should be in the center of that line.
Right.
And then that would lift her pelvis up, right? So things always work together. If her tail goes down, her abdominals will go up or her belly will lift up because everything moves as one. So it's not just tuck your tail, it's take your entire pelvis, move it on those femurs and get stable. But her femurs are so wide, we're going to have to get those legs back in so that we can fix that dysfunction. But the symptom, we're going to actually call that the symptom. The dysfunction is her rotation right now. So if you could draw the other plumb line, yeah. I want you to see the rotation, especially look at how much we mentioned was behind the line on the right side. Now look at how much is in front of the line on the left side. Right. Like this is such a great visual. Like we can't argue about that. I don't know if you can draw two of them, but again, the game is like when you're a kid, what's different in the picture? So Dr. Reese, what's different in this picture? What do you see?
Yeah, look at the ear is forward from the line.
Yes.
The shoulder is on the line.
It's a little forward. It's a little forward.
But compared to the other one.
Right.
Yeah.
Yeah. And what we know for sure is they're not balanced.
No, not right? At all.
It doesn't have to be perfect. It has to be on the line. Her bum's a little better here. Her left side is a little bit better. You'll probably notice the more we do this, people tend to stack on their left, do on their right. Like a lot of externally rotated limbs on the right, or gestury, like all your moms who put their kid on that left hip, all the people who carry their bags. There's a symptom that you'll see come up a lot. A
So
stacked left leg.
because she's off balance, she
Yes,
has
sir.
the wide stance.
Yes, she has to, or she'll fall on her face.
Right.
Or honestly, she won't fall on her face. She'll spin.
Her
Her
foot
right
should
leg
be
will
right
come
here.
up here. Yeah.
Her foot
The
should
right
be,
leg is not stable. Her left leg is her go-to leg. The right leg is all about driving the car.
yeah.
That leg drives the car. Sits down, externally rotates, pushes the pedals. And then when she stands for long periods of time, she probably stands on her left leg.
Yeah.
But the potential is there. We have arches. We have great looking feet and toes.
Yeah.
I think once the pelvis becomes stable, the feet are going to be a great asset because those are great looking feet.
Yeah. She's pretty
They're
much
just,
straight. She's not everted too much at all.
yeah, they're just going the wrong way. Like, I
Right.
love looking from the back. If you draw the line from the center of the heel straight up, that's a really good way to see what's happening in the rotation / alignment there. There you go. So, I mean, you can see that's not straight. Like, don't you just want to grab the left leg and kind of turn it back and put it where it's supposed to go? It's a little rolled in. Like we said, it's internally rolled in. This is not knock-kneed. This is internal rotation.
Right.
Not knock-kneed.
Yeah.
We can change this. Knock-kneed, your bones look like your bones, but this is just very weak pelvis muscles.
Yeah. And she did report to me that she has back pain. So
I actually am glad to hear that. And I say that because pain is your source, that your body is saying, hey, this hurts, fix it.
right.
I'm really glad she acknowledges that. And I'm really glad that it fits her profile because we can do a lot for her back pain. She's doing nothing but living in that back. It's really working hard for her. And that's going to affect everything. Your kidneys are right there, your organs. Like it's a lot. I'm sure it's a lot.
Yeah.
Yeah.
Indeed. So we need to get this young lady some postural
Straight.
therapy.
And then the extension, like people say, well, what do you want to trade it up for? Stronger lateral glutes, stronger thoracic extension. So above and below, we're going to help above and below because the body is all one system.
Right.